Seminars are a great way for people to learn more about surgical weight loss. We offer in-person seminars as well as the online seminar, and hope you find it as valuable as we do. During this seminar, you will gain a greater understanding of the disease we call obesity, what qualifications are needed for surgery, what types of surgical options are available to you, how your life will change with the lap band, and the process you'll go through with surgical weight loss. In 2004, Dr. Ray started the lap band program in Bloomington, Indiana. He received his training from Dr. Jeff Allen and Dr. Paul O'Brien, both of whom are recognized internationally as experts in the field. He's performed over 600 lap band surgeries to date and recently published his results with gastric banding. Because Dr. Ray's results compare favorably with the best programs in the world, this paper is now part of the training for all lap band representatives. His results are setting the standard for successful band programs in the U.S. A successful weight loss program depends on a multidisciplinary team. Ours is experienced and comprehensive, including an expert surgeon, a physician assistant, a psychologist, a full staff of surgical nurses and techs, a bariatric facilitator to assist with your insurance approval, and an active support group. Our facility is dedicated to advanced laparoscopy. Our state-of-the-art surgical center was built solely for that purpose. Every detail in planning revolved around the basic, fundamental principle of building the best laparoscopic center possible. There is quite simply no other facility like it in South Central Indiana. As a result, we've built a center which enhances the health of all patients in the area. We're able to offer minimally invasive bariatric surgery for people who suffer from obesity. We are a fully licensed ambulatory surgical center in the state of Indiana. We're also a fully accredited bariatric center of excellence. Obesity is a disease of excess fat storage. It's a multifaceted and lifelong disease, which is progressive and potentially life-threatening. The word morbid translates to illnesses like diabetes, high blood pressure, sleep apnea, and joint pain, amongst many others. If you're suffering from any of these, you may feel that you have several individual illnesses. In reality, they stem from one disease, obesity. These conditions, which are caused or associated with obesity, are referred to as comorbidities. The good news is that with weight loss surgery, most of these associated conditions can improve or even resolve. Here are a series of slides to show you what's happened over the last few years. If you look at the light blue states, you'll see the percentage of the population that's obese is between 10 and 14%. Not bad. However, as the years progress, we have to keep adding and adding colors to reflect the growing obesity epidemic. Let's talk about some of the impacts obesity has on your day-to-day life. Socially, obesity is still an acceptable form of discrimination. You may be required to buy 2 airplane tickets. Some companies deduct wages. People are at ease with jokes within your earshot. Obesity can lead to a poor sense of psychological and social well-being. Problems such as depression and anxiety are huge concerns. Some people simply struggle with day-to-day living. Even basic hygiene can become almost impossible. What does it cost to be obese? With a BMI of 35 or more? Studies have looked at average medical and drug costs, out-of-pocket health care expenses, lost wages, money spent on commercial weight loss programs, prescription co-pays for extra medication, and extra food. The number is over $18,000 per year. This leaves us with the medical health issues found with obesity. What's the big deal? Why are we so worried about this? It's because we know that obesity causes major health problems. For a person with a body mass index over 30, there's a 70% increase risk for heart disease, 75% increase for stroke, 400% increase for diabetes, and a 55% increase for an early death. What are the chances of you dying from your weight? Some 400,000 people in the U.S. die every year of weight-related problems. That's twice the number of breast and colon cancer deaths combined. There's a whole host of medical problems as the result of weight. Arthritis, high blood pressure, GI problems, acid reflux, and certain types of cancer. There are even difficulties with breathing, like asthma and sleep apnea. Let's take a minute to recap what we've just learned. First, obesity is reaching epidemic proportions in the United States. It's caused by many different factors, including behavioral, genetic, and environmental. Obesity is potentially life-threatening by raising the risk of increased comorbid conditions. We are all used to getting on the scales and seeing how much we weigh. In medicine, and in particular in bariatric medicine and surgery, we look at a number called the body mass index, or BMI. This looks at your height and weight together. If you're 6'10", play football, and weigh 250 pounds, you're probably too small. If you're 5'2" and 250 pounds, you're too big. The BMI levels the playing field. You may or may not know your number, but it's easy to figure out. Simply click on the button seen on this side to find out more. Normal BMI is going to be less than 25. Overweight is defined as a BMI of 25 to 30. However, there can be a lot of give and take. A BMI of 30 to 35 is characterized as Class 1 obesity. Severely obese, or Class 2, include those with a BMI between 35 and 40. And the morbidly obese, or Class 3, are those whose BMI is 40 or more. Patients with a BMI of 40 or more qualify for surgery, even without comorbidities. Traditionally, patients with a BMI of 35 or more with developed comorbidities from their weight also qualified for surgery. Several studies have shown that patients with a BMI greater than 30 with at least one serious comorbidity benefited from having a lap band placed. As a result, in early 2011, the FDA approved lap band surgery for these patients as well. Some surgeons have suggested that patients with a BMI greater than 40 should have a gastric bypass rather than a lap band. In our practice, we don't believe there's an upper limit. Even patients with a BMI in the 70s have noted good outcomes after lap banding. We presented our results with lap banding in patients whose BMI was greater than 50 at an international forum. We found they had excellent weight loss with no increased risk. We use a broad age limit of 18 to 64. Most centers stop at age 60. Some studies report that complications go up and weight loss diminishes over the age of 65. Indiana state law requires you to be obese for at least 5 years, as you must show this is a chronic, long-term problem. You also need to demonstrate that you've tried to lose weight without surgery. Most insurance companies require a 6-month supervised diet. Our facility offers a 6-month non-surgical weight loss program as well. In summary, you qualify for surgery if your BMI is more than 40 or more than 30 with obesity-related health conditions. You are between the ages of 18 and 64. You've been overweight for more than 5 years. You have been unable to lose weight through diet and exercise. You do not have an illness that has caused you to be overweight. You are committed to making changes in your diet and lifestyle, and you are willing to continue working with and be monitored by your doctor. Let's look at who is not a surgical candidate. If you're an active substance abuser or have been in recovery for less than 2 years, we are not able to operate. If you suffer from untreated psychiatric disorders, such as borderline personality or severe depression, it's best to take care of your mental status before coming in for surgery. Lastly, if you're not compliant with the pre-op stages, including any insurance requirements, we may not be able to proceed. Let's take a minute to look at what we've learned so far. To understand if you're a candidate for bariatric surgery, ask yourself a few questions. Do you have a BMI of 40 or more, or greater than 30 with comorbid conditions? Are you healthy enough to undergo a major operation? Are you free of drug and alcohol problems? Are you ready to comply with the program requirements? Do you understand the surgery and its risks? It's one thing to talk about losing weight. It's quite another to actually lose weight and keep it off. There's been tremendous research in the field of obesity over the past few years. 20 years ago, obesity was thought of as a black box with 2 arrows, calories in and calories out. We're now filling in the details of that black box. This has led to a new understanding of obesity. The system our bodies have for maintaining proper weight is far more complex than we ever thought. Diet and exercise have been the standard recommendations for many years. Unfortunately, the failure rates for diet and exercise alone is 95% at 2 years. That said, making good food choices and staying active are important components of a healthy lifestyle. This is true whether you have a band or not. In fact, this is true whether you have a weight problem or not. So having a band doesn't excuse us from making healthy choices. But diet and exercise alone probably won't be enough to take care of a serious weight problem. Medicines for weight loss have also been disappointing. The weight loss is modest at best. There are serious side effects. They're expensive, and the weight comes back after stopping the medication. This leaves us with the surgical approach to weight loss. There are 3 different kinds of bariatric procedures offered today. There are malabsorptive procedures, which shorten the digestive tract, and you'll see this type in the biliopancreatic diversion, also known as the switch. With these procedures, you can eat what you want, within reason, as you don't digest much of the nutrients. Then you have restrictive procedures, which simply limit the amount of food the stomach can hold. The lap band, sleeve, and vertical banding procedures are examples of this. Then finally you have the Roux-en-Y gastric bypass, which is a combination procedure. The gastric bypass has been around since 1967. This was traditionally done with an open incision, but is now usually done with a laparoscope. Patients lose weight quickly at first, but after 5 years, they tend to regain a portion of their weight. Although gastric bypass is much safer than it once was, there are still serious complications associated with this surgery. Staples are used to cut and reattach the stomach and intestines. Any of these may develop a leak. This can happen even in the hands of a skilled surgeon. Leaks are the most dreaded complication and can lead to infection, peritonitis, and even death. Ulcers and bowel obstruction are important long-term risks to watch out for as well. In addition, because you're not absorbing nearly as much of your normal anatomy allows, there is a lifelong risk for nutritional deficiencies. A high-sugar meal can lead to dumping syndrome, which is exactly as it sounds. The option we offer here is the lap band procedure. It's been around since 1991. The procedure is performed laparoscopically and will leave you with an implanted device which will use to adjust the band to your best fit. There's a small port which lies on your abdominal muscles. You may be able to feel it, but it should not limit your activities. Most people can't even see it, although some who become slender after surgery can see a slight bump. Most patients think that's a good problem to have. When the band's adjusted properly, you'll get full with a modest amount of food, and stay full between meals. Because it's adjustable, we're always able to monitor your weight and keep you on track. Also, since we're not cutting or stapling your stomach, this procedure comes with the lowest risk for complications. Here's a short video to demonstrate how the surgery is performed.
During a minimally invasive procedure, an adjustable band is placed around the upper part of the stomach, creating a small pouch. The band is connected by thin tubing to an access port below the skin. Through this port, your surgeon adjusts the lap band by inflating or deflating the inner lining with saline. As the band inflates, the stomach outlet becomes smaller. This helps reduce or restrict the amount of food you eat and slows the emptying into the lower stomach, helping you feel full sooner and stay full longer.
The lap band is a less complicated procedure than others being performed today. There are fewer post-op complications, as we do not cut or alter your stomach or anatomy. The procedure takes about 45 minutes and is usually performed in an outpatient setting. The total weight loss after 5 years runs comparable to the gastric bypass, while not running the risk for malnutrition. In the case of pregnancy, illness, or other scheduled surgeries, the band can be adjusted to allow you to receive more nutrients. Our patients lose an average of 60% of their excess weight by 5 years without regaining weight. Of course, with any surgery, there are risks. With any implanted device, the port or band may erode or slip out of place. This may require additional surgery to correct. The port itself can flip or leak, in which case we would need to change the port. These will be discussed in further detail. Once you've gone through surgery, your first fill is typically performed 6 weeks later. Saline is injected through the port in a routine office visit. Most patients don't even feel the needle. This allows us to find the right level of restriction to meet your individual needs. On day 1, you'll be kept to clear liquids. From there, we'll move you to protein shakes. However, you will still be restricted to liquids. Moving into weeks 3 and 4, we'll move you to a pureed diet. And once you reach week 5, you should be back to eating a balanced, healthy diet. The goal of your band is to provide you steady, healthy weight loss. You will be able to eat solid foods. However, you will need to chew thoroughly and eat slowly. Take caution with thick breads and tough meats, as the opening to your stomach has been reduced and food may get stuck. We recommend not drinking during your meals, as that tends to flush out the food of your pouch, defeating the purpose of your band. You'll also want to avoid high-calorie liquids. After you have achieved weight loss, what happens to the weight-related illnesses? Most will either improve significantly or completely resolve. Eat 3 meals a day. Eat slowly and chew thoroughly. Stop eating as soon as you're full. Don't drink while eating. Do not eat between meals. Eat only good quality foods. Drink enough fluids throughout the day. Exercise 30 minutes a day. Drink only low-calorie fluids, and always keep in contact. With any surgical procedure, there are symptoms you want to be aware of. With the adjustable banding procedures, there's always the chance the band can be too tight or has shifted. If you're vomiting or have abdominal pain in the weeks after surgery, please contact our office right away. We'll check the fit and placement of your band and help you understand why you may be having such symptoms. In the previous section, we discussed living with a lap band. You learned that any weight loss surgery, including the lap band, is only a tool to help you lose weight. You'll only get out of it what you put in. We've informed you of our multidisciplinary team approach and how we're dedicated to helping you every step of your journey. We have an overwhelming majority of patients living happy, healthy lives thanks to weight loss surgery, and you can share in that success. You have the ability to lose weight and keep it off. The first step to go through with your insurance company is to make sure bariatric surgery is covered. It's important to remember that just because it may be covered doesn't mean you'll be approved. Our office will help you get ready for the requirements of your insurance company. You will most likely need to document that this is a long-term condition, lasting at least 5 years. Then you'll have a physician-guided diet and exercise program to follow for 6 months. If you're not approved, we do offer private pay options. Speak to our office if you have any concerns about your policy or the financial aspect of surgery. To get ready for our process, you should schedule an initial evaluation with Dr. Ray. During this consultation, we'll complete a full history and physical. We recognize that a good outcome goes beyond a successful surgery. As a certified center of excellence, all of our patients undergo a comprehensive workup. This includes a dietary and psychological evaluation. These can also be done in our office. If your policy requires 6 months of physician-supervised weight loss, we'll help you achieve that, either through our program or through your primary care provider. We'll complete all the documentation needed for insurance approval, and if you wish, we'll submit them for you. There's no additional charge for this. After all this has been accomplished and we've received prior authorization from your insurance company, we'll schedule your surgery. Many insurance companies now require 6 months of non-surgical weight loss prior to authorizing bariatric surgery. We've developed Healthy Living, a 6-month program based on NIH recommendations. This program teaches the basics of nutrition and exercise, as well as an overview of obesity as a disease. It's useful for patients who are contemplating lap bands, but the information gained will also be helpful for people who decide that surgery isn't for them. It consists of both individual as well as group sessions. Many, but not all insurance companies, will accept this as your 6 months of non-surgical weight loss. There are several studies you may need to undergo prior to surgery. These are done to ensure that you are healthy enough to go through the procedure. A sleep study is sometimes ordered to determine if you have sleep apnea. If you are someone who stops breathing while you're asleep, it's important to know that before surgery rather than after. If you have risk factors for heart disease, we may ask you to undergo a test of your heart to help minimize any risk of heart attack around the operation. The pulmonary function test is utilized to tell how well your lungs are functioning. If you are a smoker, it's important to quit completely for 6 weeks prior to surgery. It's strongly recommended that you do not resume smoking after the procedure. The lap banding procedure is usually completed in less than 60 minutes. Some patients choose to stay overnight in the hospital. Most prefer an outpatient setting. You'll be evaluated to make sure you're an appropriate candidate for outpatient surgery. Our support groups. Attendance is strongly recommended, as you'll be able to meet patients going through similar experiences, as well as speaking to people who are further along in the process. We believe our excellent results are largely due to our careful follow-up. Routine follow-ups start 6 weeks after surgery and take place every 4 to 6 weeks during the first year post-op. From there, we'll see you every 3 months during the second year. Then, twice a year from then on. In our practice, we believe that failure is not an option. If at the end of the first year you've not reached a benchmark, we'll continue to see you at a more intensive schedule until you do. Can you comply with the therapy and follow-up that's so necessary after weight loss surgery? Have you made many attempts at weight loss? Are you comfortable with your decision? Are you apprehensive? Would you benefit from a 6-month program? Thank you for your time and consideration in completing the seminar. We look forward to answering any of your questions and are privileged to be part of your journey to a new and healthier life.